According to a recent World Health report, about 7 in 10 women are affected by fibroid, a non-cancerous tumor that grows from the muscle layers of the womb. That's our focus today on Sound Health. I'm Olasumbo Modupe. Welcome to the show.
Fibroid affects around 30% of all women by the age of 35 years and about 20 to 80% by the age of 50 years. It usually develops between the ages of 16 to 50 years, the reproductive years during which estrogen levels are higher. Medical experts say once a fibroid develops, it can continue to grow up to after menopause. As estrogen levels fall, the fibroid will shrink, although it remains unclear exactly what causes fibroid. Experts say it may be related to estrogen levels. Around 1 in 3 women with fibroids will experience symptoms such as anemia as a result of heavy periods, backache or leg pain, constipation, discomfort in the lower abdomen, especially in the case of large fibroids. If there are no symptoms and the fibroids are not affecting an individual's quality of life, treatment may not be necessary.
Welcome back. Joining me now to enlighten viewers on managing fibroid is a consultant obstetrician and gynecologist, Dr. Oluwaseun Orekoya. Welcome to Sound Health, Doctor.
Thank you for having me once again.
Okay, we've had cases where some patients, when they go for surgery, at the end of the day, they pass away.
Well, it is very, very rare, and actually is a misconception. Okay, women don't die from fibroid surgery as common as people think. Okay, there could be complications. Okay, that could lead to a death of a woman, but it's very rare. Far in between. Okay, now the reasons why women die, we should ask ourselves. The first problem is that our women, they don't come early. They present very late when the fibroids are very big, and when the fibroid is big, it is easier to remove the womb than to say you want to remove only the fibroids. But they will insist that no, I want to have babies, don't remove my womb. And in the process of removing only the fibroid without removing the womb, there are possibility of bleeding. So most of the problem we have during surgery is bleeding problem. Okay, but many times there is a way around it, especially when the surgeon is well prepared. For instance, we've been able to remove fibroid as big as over 5 kg before, with the woman going home, no problem. But of course, the woman had about 5 units of blood transfused. Okay, so the issue is that the women come late. If they come very early, when the fibroid is very small, I can tell you that the mortality rate from fibroid surgery will be almost insignificant.
Okay, for a woman that insists on keeping her womb, maybe she has no issue at the moment.
Yes, but why has she waited that long? She could have come earlier, and that is our appeal. The truth of the matter is that management of uterine fibroid, even though we have several management for it, the surgical management is actually the one that could take out fibroid.
Okay, are there proven natural methods for treating fibroid?
Most of these herbal drugs and all these concoctions that our women use and thinking that they work, the truth of the matter, they don't work. I've been in this practice and I've seen women who have spent their livelihood on herbal concoction because they don't want to have surgery. Eventually they will come. They are the ones that will come with the very huge fibroid, and then they will be begging you that please don't take out my womb. It makes it difficult. So many times when we do such operations, we have our hearts in our mouth because of the fact that the fibroid are so big. But if they come early and seek medical intervention early, the complications will be far less. apart from the fact that they are coming at a very late stage, when the only way we can bring out the fibroids is to give them a mainline incision. Okay, if they come early, we could give them a bikini incision, that is the finest day, that no one will even know that they've had surgery. But when it's so big, we have no other option but to cut them, and then they have this scar that we always remind them they've had surgery.
So why do women wait for that long?
I think it's not actually the fear of removing the womb. It's the false fear they have, is the fear of having surgery. Now, I don't know, people have this belief that having a surgery is abnormal, and everyone prays during the wedding ceremony that you won't have any cause to have a cesarean section. So it first of all is the belief, which we really need to work on. There is nothing wrong about having surgeries, because we have that belief that surgery is wrong or is abnormal, so it becomes a last resort. So they want to try other means. Okay, it's after trying those other means it's not working, that's when they then think of surgery as a last resort. It's not really the fear of losing their womb. Okay, because we've seen a lot of women that even come and say, oh, I'm tired of this problem, just remove the womb, it has to get to that. Okay, it's not the fear of removing the womb. Okay, so but you can also say that some people also are afraid that, oh, especially when it is big, are they going to remove my womb? And then of course this misconception that when people do fibroid operation they die is actually not true. You can look at the statistics. The truth of the matter is that it's only the few, maybe 1 out of 1,000, that had a mortality that people tend to hear about. But the 999 successful surgery, no one sing about them. Okay, that is just the truth. Mortality from uterine fibroid is usually very, very minimal when it is done by professionals.
Is surgery always the last resort?
Well, surgery is important in managing uterine fibroid, but it's not in all women you have to do operations. The reason being that we said 7 out of 10 women might have some degree of uterine fibroid, but majority of them do not have symptoms. So a woman who does not have any symptom from uterine fibroid does not require any form of treatment, not to talk of even surgery. For those, the 25% of women who have symptoms, now it depends on what kind of symptoms they have. Some symptoms are manageable using medical treatment, whereas some will require surgery, especially if the woman is considering conserving her fertility, then surgery might be required. But it's not in all cases that we will operate the women. For instance, I'll give you a simple example. A woman who is close to menopause, who is having symptoms from uterine fibroid, we don't need to remove the womb if we are sure there are no abnormalities, no cancer. We can give the woman a form of medical treatment until she enters into menopause, even though she's symptomatic. So it's not all the time we do surgery.
Those medications, are they going to shrink the fibroid?
Now, the medications that we use depend on the condition the woman is presenting with. Sometimes a woman will present with heavy bleeding. All what we need to do is to give drugs that will reduce the bleeding. Most of the times, those drugs don't shrink the fibroid. The fibroid remains the way it is. Sometimes women may present with pressure symptoms, okay, that pain, and what we need to do is to give painkillers, okay. But in some women, especially women who have very huge uterine fibroid and they don't want to have their womb removed, there are some injections that we can give that will help to shrink the fibroid. But those injections have their own side effects, in the sense that you can't use them forever. Most times they are given monthly, and you give them for like 3 to 6 months maximum. But within that period, the fibroid would have shrunk to a size that you'll be able to manage doing surgery. Okay, and then apart from those women whom you want to use the drug to shrink their fibroid, we can also use it in women who are close to menopause. because we know that by giving them those injections, the next thing is that they transit into menopause. So the chances of the fibroid going is minimal. But as I said, the side effect of that drug is that you can't give it forever, and when you stop giving them, the woman is going to have rebound growth. The fibroids start growing again rapidly. So because of that, we don't usually recommend it for women who still want to have babies, because the fibroid will grow back. The best thing to do is to remove the fibroid.
Okay, what's the probability of being fertile again before and after surgery?
Good. Now, like when I said, sometimes it could be due when a woman is infertile, okay, and then she has done a lot of investigation, they couldn't find any reason, and then she has uterine fibroid, and then you go ahead and remove the fibroid. The chances of such a woman conceiving thereabout is over 50%. So the chances of conceiving after a fibroid operation is very, very good. And moreover, in some cases, even when probably the woman have tubal problem and she needs to go for IVF, that in vitro fertilization, such women will still be advised to do the fibroid operation, because it helps to increase the success rate of the IVF. So doing fibroid operation many a times enhances fertility.
What are your final thoughts on managing fibroid?
I think what I need to do is to appeal to our women, okay? Fibroid is very common amongst us, okay? And at every point in time, you might have 1 out of every 4 women having uterine fibroid. Now, the solution to uterine fibroid is not herbal concoction, is not native drugs. The truth of the matter is that they cannot cure fibroid. The only solution to it is to come to the professionals. Let us see them. It's not all the times that we do operation. There are medical management. If we don't want an operation, if you come early, there are still other methods that we can do, which we can go into at this very point. But then the best thing to do is to seek a gynecologist, and I'm sure at the end of the day, maybe we'll stop having all these with uterine fibroid, and probably we'll be able to save our women from dying from a condition that normally should not kill.
Okay. Thank you so much, doctor, for sharing your expertise with us on Sound Health.
Okay, you are welcome, and thank you, viewers.
All right, that was Dr. Oluwaseun Orekoya, a consultant obstetrician and gynecologist. Sound Health continues with trending and home essentials. Please stay with us. The program continues. Welcome back. It's still Sound Health on Lagos Television, and I'm Olasunbo Mudupe. Innovation this week is up next. Please stay with us.
Self-administered HPV test.
The human papillomavirus, HPV, infects nearly 80% of sexually active women. Medical screenings are vital to detect certain strains of cervical cancer linked to HPV. The virus causes over 250,000 deaths from cervical cancer a year. Nearly 85% of these deaths are in third world countries, where access to healthcare screenings is very low, if at all available. Strategies are needed to test and treat everyone, regardless of geography. Scientists have developed self-administered HPV test kits that include a swab and a test tube or mail-in box. The idea is that tests can be delivered to communities everywhere for women to administer their own test and send a sample back to a lab. By offering a greater number of women simple and accurate screenings for cervical cancer, self-administered HPV tests can save money and lives all over the world.
That's Sound Health this week. Please share your thought with us on any health issue on 0818-815-3695 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.